DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Hi there folks, welcome to DocTalk. I'm Dr. Dan Thompson here, and we have an exciting show today. Dr. Shelley Laughlin will be joining me. She's a clinical associate professor here at Kansas State University, and we're going to talk about preparing the goat herds for your fall breeding season. Stay tuned, and I sure hope you enjoy the show.
We've been using the Multimin on our donor cows, and after we started using it on them, we've seen a definite increase in grade number 1 embryos. I like the results that I get using Multimin with the AI conception rate.
Their minerals not up to snuff, you're going to have problems, and I definitely think Multimin is good for, general healthiness of the cattle.
We think Multimin more than pays for itself.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations. Dr. Laughlin, welcome to the show.
Thank you.
It's great to have you here as always. Folks, this is Dr. Shelley Laughlin. She is an associate clinical professor here at the Veterinary Health Center at Kansas State University and heads up our ambulatory service. And you see a lot of cases, and you spend a lot of time with small ruminants.
We do.
And so today we decided we're going to talk a little bit about setting up for that fall breeding season, and let's start out with the does and some of the things that you want producers to be thinking about, be looking at, deciding.
Sure. Certainly if you keep that doe herd in good condition, you're going to have better pregnancy rates, better kidding rates, and so your bottom line is overall going to be better. So things I encourage people to look at is body condition. You want those girls in good shape, not obese, not too heavy. You want them in a body condition score of about 2.5 to 3 out of 5 coming into that. If you get them too heavy, they don't respond well, they don't breed well, they don't settle well. If you get them too light, then they're not ovulating usually. Flushing doesn't work as well, and we need to increase that body condition score a little bit.
What are some of the things if I'm looking at the doe that kind of gives me a cue, that I'm getting too thin, that the doe's too thin?
Sure. Things we look at very similar to cattle, but we are looking at cover over the ribs. So can you palpate the ribs? Goats tend to put on fat internally first, externally last. And so if you have a goat that is fat to look at, they are really obese because they will have a lot of fat around their internal organs.
Okay.
And so we want to be able to slip our fingers in that flank area or in the paralumbar fossa there along their backbone.
Mm-hmm.
You want to be able to just slip your fingers underneath those processes off their spine, just a little bit there, indent. If you can't see that and you can't see at least a hump a little bit from their rib, they're going to be too fat.
Okay, and then on the opposite, if I can count every rib and I can see the hooks and pins in the pelvis area and that process along the spinal, if I'm seeing all that, I'm too thin.
Right. If that thing looks like a peak on a church, they're too thin. You want it a little more laid out.
So I think it's important, and then remedy, a lot of times, at least in the beef business, you and I both see, there's a point of no return of
right.
Getting too late where you can't put weight back on them.
Right. We need to have them. You'll have about 30 days that you can push them one body condition score. So you need to plan ahead. You need to be looking at those girls really, in July and saying maybe I need to supplement a little bit, or maybe I need to throttle it back a little bit if they're too heavy.
Yep. Well, I think that gives us a good jumping off point, and we'll come back after the break more with Dr. Shelley Laughlin. We're going to be talking about preparing for the fall breeding season with your goat herd. We appreciate you watching DocTalk, and we'll be back after the break.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd.
This hog is Hanover hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
You know just how costly BRD can be, but did you know that bacteria like Mannheimia and Pasteurella can cause BRD? That's why veterinarians and cattle raisers focus on preventing pasteurellosis with a quality vaccine like Pulmogard PHM1. It's ready to use, highly syringeable, and provides comprehensive protection with a single dose. For pasteurellosis protection that's truly the head of the class, ask your veterinarian about Pulmogard PHM1.
This segment is brought to you by Norbrook Laboratories, manufacturers of Noromycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Hey there, folks. Welcome back to DocTalk. I'm Dr. Dan Thompson, and I'm here with Dr. Shelley Laughlin, who is an associate clinical professor, or clinical associate professor, associate clinical professor.
Sure.
Good. Anyway, Dr. Laughlin is a professor here at Kansas State University. She teaches and is a practicing veterinarian in our ambulatory clinic at the Veterinary Health Center, sees a lot of cases out in the field, teaching the students. And now we're talking about breeding season with goats. We talked about the does, and now let's talk a little bit about the buck.
Okay.
And specifically the breeding soundness exam.
Sure. So we want those males in good condition as well. I also usually encourage them, depending on how big of an area you're going to turn them out on. If you're going to turn them out on, 5 acres, certainly we can get away with a lot. An animal that's maybe a little bit not quite as in good a shape and things like that. If he's going to have to cover 70 or 80 acres or 120 acres, and you've got him on a lot of territory, he's going to have really good feet, really good conformation, and have a little extra condition to spend, running the marathon.
Yeah, well, no wheels, no kids.
Yep. So I like to look at feet, make sure their feet are trimmed up good, they're not overrun or underrun. His feet are in good shape. I always look to make sure to body condition. I want him, again, somewhere between a 2.5 to 3, depending on how many does and how many acres he's going to have to cover. And then we go ahead and do the reproductive part of the exam, where we're looking at his sperm quality. So are his spermatozoa moving? Is there enough there? Are they in the right shape? And I usually encourage people to look at this, 45 to 30 days ahead of breeding season. So if he is bad, you have time to get a replacement for him.
Right. What are some of the, percentages on bad bucks or bucks that aren't able to service? I mean, is it more common than what people think or less common than what people think? I mean, the thing is, it's devastating if it happens.
It is, and it can be quite expensive at the last moment to try and track down a quality animal to replace an animal that you have, and you may not even be able to do that.
Right.
Find a replacement for him.
Yeah, and that's what I see. I mean, it's more the insurance, and it doesn't necessarily mean that buck won't get injured or
No.
something won't happen out there in the field, but it's just for the price.
Yeah, what you have invested in doing a breeding soundness exam is well worth the money spent to having a bunch of open does.
And we always recommend, that y'all work with your local veterinarian and get in there and form that relationship. But those veterinarians will be able to put together kind of a herd breeding soundness exam kind of calendar for producers.
Exactly, and it depends, again, how many does does he need to service? Is he the only male in the herd? Are there others? Where he may have lesser quality semen, but it may be okay for the circumstance in which he's going into.
Well, again, great information. Make sure that you get your breeding soundness exam on your bucks prior to the breeding season. And when we come back, we'll continue our discussion with Dr. Shelley Laughlin on preparing your goat herd for the fall breeding season. You're watching Doc Talk. We're glad you joined us, and we'll be back in a minute.
This tip brought to you by Batril 100 Enrofloxacin Injectable, now approved for use in controlling BRD in high-risk cattle. Batril 100, right the first time, whether it's controlling BRD in high-risk cattle or treating BRD.
Hi there, folks. I'm Dr. Dan Thompson, and this week's On the Farm Tip, sponsored by Bear Animal Health, focuses on low-stress cattle handling of sick cattle. When a calf is identified with bovine respiratory disease in its home pen, we have to move it to the hospital. Those animals should not be run or stirred up as they're sick with a respiratory disease. If they get to the hospital pen system and we're going to have a delay before we doctor them, be sure to give those animals shade, water, and a little bit of hay. Now, when we move those animals through our system, through the tub, it's important not to mix larger animals with smaller animals, as those animals can become trampled or get pinned underneath the large animals, and the outcome's not good. Low-stress cattle handling, early disease identification, all of these things are important to assure animal health. This is your On the Farm Tip from Bear Animal Health, and I'll see you down the road.
With BRD, every second counts. And when you get new high-risk cattle, you've got a choice to make. You can either take your chances and wait and see what happens, or you can take charge of BRD. Right from the start, treat bacteria up front with Batril 100 Enrofloxacin Injectable, now approved by the FDA for BRD metaphylaxis and high-risk cattle. Ask your veterinarian about Batril 100 and make it your go-to drug to control BRD in high-risk cattle or for treatment of BRD. Batril 100, right the first time.
Dr. Dan here. Whether I'm driving up and down the roads covering the state of Kansas, or I'm getting between Riley and Manhattan for my job, I'm driving a Ford truck. I'd like you to come out and visit my friends here at Dick Edwards Ford. They have a truck that'll suit your needs, whether you're looking for power with a Power Stroke diesel, or if you're looking for fuel efficiency with the new EcoBoost engine, they got a truck that's just right for you. They're located 2 miles east of the Town Center Mall in Manhattan, Kansas, and they'll bend over backwards to help you. And I'll see you down the road.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
Hi there, folks. Welcome back to Doc Talk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm pleased to have my friend and colleague here, Dr. Shelley Laughlin, who's also a faculty member at Kansas State University's College of Veterinary Medicine, and she works in the clinics teaching our students, our fourth-year students, teaching third-year students, but she's an associate clinical professor, and we're talking about goats, breeding the goats, and we've gone through kind of the body condition score, making sure the does are ready, getting that breeding soundness exam, and now, you know, there's sometimes we bring in replacements or we bring in animals and we're like, you know, what are some of the things on a veterinary side and kind of the bug animal problem that we could have with breeding?
Certainly, if we're talking about bringing in new animals, things I encourage is to keep them isolated for 30 days. Good biosecurity can save you a lot of headache down the road. In that situation, we're looking for caseous lymphadenitis or abscesses starting to manifest. Also, foot rot, contagious foot rot in small ruminants can be really devastating as well, particularly if you get that in breeding season and it lames up particularly a male animal.
Yeah.
So we want to be on the lookout for those in that 30-day wait period. After that, some of the things that can kind of get in there and be a problem that you may not have, that may not be visible up there in the front end, but you'll see later on, is diseases like Campylobacter and Brucella, and usually those will result in abortive diseases, sometimes early abortive diseases where that female loses that pregnancy, and so you'll just have female cycling back. They may cycle and become pregnant and then lose that fetus later on in gestation. And any of those are a bad situation. Good biosecurity, vaccination program, those are hard for me to do a blanket vaccination program for. It depends on the herd history. Are they bringing in new animals? Are they a fairly closed herd? So a lot of those would vary on that, and certainly something you would want to work with your veterinarian with.
So some of the two of the bigger ones that we're looking at are Campylobacter and Brucella. And when we're talking about Campylobacter, what are some of the things or key points when dealing with Campylobacter or Campylobacter outbreaks?
Sure. The tricky part about Campy is that it can be kind of a sleeper, and so you may purchase a doe that's infected and you don't know.
Right.
And so then the male breeds her and he breeds somebody else and it spreads throughout the herd and you have a disaster on your hands. Vaccinating certainly is very helpful in that situation, and so if you're purchasing a lot of replacement females, it's something I would vaccinate for. Campy is one that can manifest in, again, several different ways. Either she becomes pregnant and then loses that fetus and cycles again, or she becomes pregnant and carries toward the end of gestation and then loses the fetus. So if I have a herd that I'm working with that has a lot of abortions late, Campy is oftentimes something I'll look for there.
Well, any of these infectious agents can be devastating to the goat herd and the profitability of the producer.
Yes.
When we come back, we'll kind of do some wrap up on the fall breeding preparation for goat herd. You're watching DocTalk. We're glad you joined us. We're going to take a break.
This segment is brought to you by Purple Wave Auction, the easiest, most straightforward way to sell used equipment. Purple Wave, straight, simple, sold.
This is Agriculture Today from Kansas State University. With the 2013 winter wheat harvest now in the bin, Kansas growers now turn their attention to the next crop to be planted this fall. Some have saved back seed from the harvest for planting. It's wise to have that tested for germination first, as the Kansas Crop Improvement Association's Eric Fabricius explains.
Larger seed size and that kind of thing will actually benefit you in yield with the crop produced off of it. Where you had freeze issues or drought issues, you're going to find that some of these lots will have smaller seed. They're going to germinate, but they would not do as well in the field and produce when that next crop is produced. The impact has been shown through research in yield reductions.
This is K-State Research and Extension.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there and welcome back to DocTalk. Dr. Dan Thompson here with Dr. Shelley Laughlin, and we're talking about preparing the goat herd for the fall breeding season. And Dr. Laughlin spends a lot of time working with small ruminants, spends a lot of time working with cattle and all farm animals as a veterinarian, and Associate Clinical Professor here in the Veterinary Health Center at Kansas State University. And we're pleased to have you here. And
Thank you, Dan.
so let's do kind of a wrap-up then,
Okay.
you know, of some of the big ticket items that, you know, we're getting close to breeding season. Here are the things you need to take care of.
Yeah, I think the most important things to look at again is the body condition score of your doe herd for sure, but also of that buck. If you're going to use a teaser animal, you need to be getting him ready. We didn't really talk about that, but getting him ready, getting your breeding male ready, making sure he's good to go with the breeding soundness exam, looking at his feet, his body condition score. Certainly checking the udders. I usually recommend doing that at weaning time so you don't have the expense of running that open female that's not going to do her job for you anyway. But checking those udders, are they supple? Is there a mass? Is there an old infection that we need to ship her off? Bad teats, that sort of thing.
Because then the kids can't suckle.
Right. It just makes you that much more work on the kidding end of things.
Right.
Yep.
Okay.
Yeah.
Yep.
So keeping those girls in good shape nutritionally, you know, that those are really the big things. Pretty simple, small package.
Yep. Breeding soundness exam, feet.
Yep.
All important.
Yep, getting all those done. And oftentimes when I'm helping a producer, we'll do those kind of all in one visit. So if I'm there to do a breeding soundness exam, I'm also looking at his body condition score. I'm also trimming his feet if he needs it, or the doe's feet, getting them ready all at once. So it's not like that's a multiple visit event. Much of that occurs seemingly seamlessly as we do those exams.
And I think that's another thing that's important for producers and is to get that working relationship with your veterinarians.
Absolutely.
So, I mean, for the expense that it seems, I mean, I know that people say, well, this is a big expense, but the prevention that it can prevent a tragic loss. And having a second set of eyes or a third set of eyes on your operation or on your goats is just vitally important.
You bet. You know, a $50 breeding soundness exam is going to be really cheap if you end up with 100 open females.
Yeah. Oh, one.
Yeah, exactly. Yeah.
and that. And then, of course, biosecurity. Some of the things that we'd talked about there.
Certainly, I think it's a shame that oftentimes we overlook that. It's a pain in the rear. I know it's a pain on our place to isolate a newly purchased animal. It can cost you so much in the long run. That a good biosecurity, and it doesn't take much, a pen by themselves where they can't breathe on their neighbor.
Right.
That's it.
Well, thanks a million for being here
today.
You bet,
Dan.
And appreciate you taking that time out of your busy schedule. And folks, we appreciate you watching DocTalk as well. Remember, we recommend that you always work with your local practitioner or local veterinarian. And if you want to know more about what Dr. Laughlin and I do here at the College of Veterinary Medicine, you can find us on the web at www.vet.ksu.edu. You've been joining us this morning here on DocTalk. I'm Dr. Dan Thompson from the College of Veterinary Medicine at Kansas State University. We're sure glad you joined us, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
DocTalk, produced in cooperation with Drovers Cattle Network and Bovine Veterinarian. For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, Sure Trace Mineral Supplementation by Timed Injection.
Multimin 90 is an injectable trace mineral product that contains selenium, copper, manganese, and zinc. One injection provides approximately a 60 to 90 day supply for any treated animal. Trace minerals that are ingested by the animal are absorbed relatively inefficiently from the gut. In addition, other elements in the animal's diet, other nutrients, can interfere with trace mineral absorption from the gut. By injecting a supplemental source of trace mineral, we miss those sources of interference. In other words, injectable trace minerals are absorbed with nearly 100% efficiency and used much more efficiently by the animal. The most critical times for trace mineral nutrition in a breeding cow's life are the period immediately preceding calving and the period immediately preceding breeding. We try to treat mature cows, mature breeding cows, about 60 days before each of those critical time periods starts. Late gestation and early lactation are going to provide the biggest drain on a cow's body reserves for critical trace minerals. We need to replace those before breeding occurs in order to give that female an optimum chance of conceiving and becoming pregnant for the subsequent production year. Now, in our study at Kansas State University, our cows had access to a cell-fed trace mineral product. Our treated cows were injected at preg check in December, and then again approximately 4 weeks before the breeding season began. The result of our research was a 9% greater AI conception rate and a calving distribution that was shifted forward into the calving season approximately 13%. In other words, we had more calves born earlier in the season than we did in untreated cows.